Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. No? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako, ganun.
We're always with you from start to healing.
Magandang araw po sa inyong lahat. Ako po si Ciela, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating po mga manunood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yun na ubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung ano ko. May dugo na yung plema ko. Di pina-x-ray nila ako, mayroon ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita ang bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na akong nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga sa mayroon akong lungs cancer, stage 3C. Ayaw ko kasi nagpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank, malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR, pagbalik ko salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mga mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, eh, magaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po, no, yung targeted therapy po, na sabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom, nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na re-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po, no, ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo. No?
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid, saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo, hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention na pampalakas din ng resistensya. Hanggang ngayon, nagiinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, no? O bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ako, ang liig ko nawala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na inom ng binibilhan naman ako ng mga anak ko ng mga andaming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung i-effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas na sa CT scan ninyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, no? Nung pag-combine po ninyo ng PPARS at saka po ng GPT po, no? This past months po. Ano po yung mensahe na pwede nyo pong maibahagi sa kanila sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayo mawala ng pag-asa. Ang cancer, nagagamot. May Simply Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang kaiinom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po no sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Hi, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simply Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simply Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. No? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
everyone. I'm Sheila, and welcome to another enlightening episode of Simply Nature webinar. This program is powered by Simply Nature International and Simply Healed Medical Group. Just to recap, last episode we discussed the DIY pap smear for cervical cancer, safety, and alternative solutions. Lots of questions were asked and most importantly, answered by our experts. This week, discover how cancer patients can benefit from using PPARS, because tonight's interesting topic is entitled Declared Cancer-Free, What's Next? A step-by-step guide for cancer survivors. This informative session is designed to guide individuals who have recently achieved remission or cancer-free stage by providing valuable insights and actionable steps for maintaining health and well-being. We'll explore essential topics such as lifestyle adjustments, ongoing monitoring, emotional support, and strategies to prevent relapse. Whether you're a patient, caregiver, or healthcare professional, this webinar offers practical advice and support to help navigate this new phase with confidence and resilience. So we extend our sincere gratitude for all of you for tuning into this webinar, and we encourage everyone to share this online event with your friends and loved ones who will also benefit from the insights shared here tonight. So without further ado, let's dive right in. Please note that we will be having a what we call AMA or Ask Me Anything portion. So yes, questions are very much welcome. Please drop them down on the comments section as early as now, actually. So leading our discussion for tonight are distinguished health experts. First off, I'd like to introduce a successful entrepreneur and a seasoned international speaker on a wide range of topics from personal success to healthcare. He is the CEO and founding director of Simply Nature International and a PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila, and good evening to everyone. Good evening, good evening. Tonight's topic is a really positive one because the topic starts off with being cancer-free. So to all those who viewers right now who are having your fight against cancer, well, the good news is many people have succeeded with their fight against cancer. So Sheila's actually one of them, not herself, but Sheila's son, Dominic, just passed the 5-year mark. Sheila, am I correct? Has Dominic passed the 5-year mark?
It's actually this coming September, but this year is actually his survivor year. Thank you.
All right, so September. When in September will be the date?
The time that we ended the chemotherapy was the first week of September, so it should be that same.
All right, okay, so Dominic is almost on his way there. I guess those of you who like to hear what Dominic did during the last 4 years, please ask them during the Ask Me Anything segment. So tonight we really discuss what can you do to keep yourself cancer-free now that you've beaten the first round of cancer. All right, so I'll hand the time back to Sheila as she introduces the discussion. But again, reserve all your questions for after in the Ask Me Anything segment. So feel free to ask all your questions. I'll be here, and I believe Dr. Jansen will be joining me to answer all these important questions. Okay, back to you, Sheila.
Thank you, Sir Shyan. All right, now at this point, on to our next health expert. It is an honor to introduce our next speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomate of International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. And please, at this point, join me in welcoming Dr. Jansen Kalalan. Let's all watch this.
Hi everyone, welcome again to another episode of Simply Healed. We're so happy that you are here with us again today. And Dr. Jansen, welcome again.
Hi, Sean. Hello, everyone. Glad to be here again.
Today's topic is very useful and very hopeful because today we're going to talk about what do you do when you are in remission, a glimpse of what remission looks like. And that's something exciting. I pray that every one of our viewers, that we are all believing for that day where you will be declared in remission. Doc, remission is a medical term.
Yes,
what does
yes,
it
yes.
actually mean?
Okay, so when we talk about remission, it is the period or the time when there are already no detectable cancers inside your body. By no detectable, but what do I mean by no detectable cancer? So number one, there are no signs of cancer in imaging, in your imaging studies, and the tumor markers are normal. Okay,
So in other words, a key factor of this knowing that you're in remission is that you have to go for diagnostics.
yes,
So imaging is clear. So your CT scan, MRI scans
Correct.
are clear. No more signs of tumor.
correct,
And your chemistry is all your markers are
normal.
normal.
Yes, correct. So that is what remission is.
Doc, before you go on, I just want to ask, when we are considered in remission, and even for healthy people, does that mean that we are free from cancer cells?
Technically not, no, because there's still circulating cancer cells inside your body. It's just that your immune system can now fight them off. So there are no signs of recurrence. And also, we have to consider the ability of the imaging studies and the tests to detect the cancer. Now, yes, there will be circulating cancer cells inside your body, but they are not detectable by our present technology.
All right, Doc, so when we are in remission, what are the key goals that our viewers can look forward to when the doctor tells them, hey, your scan looks good, your blood works came back, everything looks great, you can ring the bell, ding, 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 victory,
Yes, yes.
right?
So-
what's the goal right now?
Yeah. So I know this is the day that we really pray for, no? The day that your doctor tells you that you are already cancer-free, you are already in remission. Okay? So the primary goal now, because at this point in time, it's very important that you prevent the recurrence of cancer.
It's very, very important that during remission, your focus is now on preventing recurrence. So you have to fight just as hard,
Yes.
but just differently, going for chemo
Yes,
sessions
yes.
or anything.
Yeah.
But you gotta be as mindful and focused as you were when you're fighting cancer. Because even for something as common and as treatable as breast cancer, 1 in 3 breast cancer will come back. And definitely the second round will be a lot tougher to treat than the first. What are the key factors? What are the main pillars that a cancer patient who's now in remission, cancer-free, should focus on?
There are a number of factors that you need to take note of. So number 1 is nutrition, or the diet that you eat. Number 2 is physical activity. Number 3 are supplements. You will need nutritional supplements for this. And lastly, what are the signs that you need to look for to know that you already have recurrence and you need to go to go back to your onco for a follow-up. Yeah.
So Doc, let's go straight to diet. What is the key kind of diet cancer patient in remission should adhere to so that they stay cancer-free?
Now, I've told my patients again and again and again, okay? Among all of the factors that you need to do, the food that you eat is the most important one. Because even if you do all of the tests, all of the treatment protocols in the world, the most expensive one, if you still eat junk, then you'll still be sick. Okay? Your cancer will recur, and if cancer does not kill you, it will be heart disease, and it will be the other diseases. Okay? So this is not just to help your cancer, help prevent cancer. It's to really make your whole body healthier. Okay? So, what is the approach? Right? So, the diet we eat to prevent cancer is the same diet that we eat to prevent recurrence. Okay? So, it is a whole food plant-based diet. This is the only diet that has been proven to show reversal of cancer. Okay? So, what does a whole food plant-based diet mean? So, whole foods means it's unprocessed and unrefined. Nothing edible has been removed from the food. Okay? And a whole food plant-based diet consists of fruits, vegetables, whole grains, and legumes. Okay? So those 4 food groups. You have to focus on those 4 food groups.
What are legumes, just in case? Because that's a vegetable word that not everybody is familiar with.
Yes. Legumes are anything that grows out of a pod. So that would be your beans, nuts, and seeds.
So we are in Philippines, we're talking about
Mongo,
long
yes.
beans.
Long beans,
Everybody
sitaw.
likes long beans.
Yes.
Sitaw. Everybody likes sitaw.
Yes.
And I like actually sweet peas because those are very nice.
Yes.
So,
Yeah, aside from those, your garbanzos, your tofu, your soybeans,
Oh,
yeah, those are
Yeah,
legumes
that's
as well.
true.
Okay, so those are the foods that you need to eat. And how about the foods that you need to avoid? So in general, that would be no animal protein. So because animal protein can increase a substance called IGF-1 in our body. So IGF-1 means insulin-like growth factor 1. So that growth factor promotes tumor growth. And that growth factor can eradicate all the effects of a plant-based diet very easily. Okay,
Wow.
with just a small, even with just a small amount. So it's very important that we keep it at a very low level. And again, remind you, animal protein, consumption of animal protein will increase IGF-1. Okay?
And so that's the key scientific reason
Yes.
why we want to avoid animal protein.
Yes.
Doc, does animal protein also include fish? Because
Yes.
a lot of time people say animal protein is no chicken, no beef, no pork, right? And then fish is like the exception.
The exception, fishes are animals, right? So
And you know,
that includes fish. Yes.
and you know, today there's lots of controversy in terms of harvested fish, farmed
exactly,
fish, a lot
exactly.
of antibiotics. So that's the problem of farmed fish. That means cultured fish. Then if you catch fish in the wild, we have the problem of
heavy metals.
heavy metals, mercury, chemical, what's that called? Toxic substances found in the fish, even in deep sea fish.
Exactly.
Yeah, so literally now it's really difficult to get clean fish.
Other foods that you have to be mindful of are saturated fats. So oils, no? So no oils. Why? Because oils, especially saturated fats, can promote metastasis. Okay, so you do not want that.
Wow.
Okay, so number 3 is refined carbohydrates. Refined carbohydrates is also known as sugar. Okay, or
Alright.
food items which are already devoid of fiber. Okay, so that would be your white rice, your breads, your candies, your French fries. Okay, so these things. So why should you be avoiding refined carbohydrates? Because it already has very low amount of fiber. Now, if you consume that, your intestine will absorb all of the sugar in that food all at once. So that will spike up your blood sugar, that will spike up your insulin. A very high insulin level can also mimic the effect of IGF-1 because IGF-1 is again what? Insulin-like growth factor 1.
It promotes tumor
It
growth.
promotes tumor growth. So insulin also has a similar effect. So you have to be very careful about refined carbohydrates.
And
Alright?
refined carbohydrates is basically your alcohol too, because alcohol
Exactly.
is basically carbohydrates.
Exactly.
Alright, so don't
Okay.
avoid drinking. As
Avoid
well.
drinking any alcoholic beverages.
So eat a healthy diet, but you know our daily life is hard to really eat healthy because the foods that we have are quite limited in terms of nutrition. So vitamins and supplements, is
Yep.
that going to be part of your life once you're in remission?
Yes, very much so. Because there are certain foods that you have to keep eating every day to prevent or to lower the chance of your cancer coming back. Okay? So how should you be choosing your supplements? So I would choose this way. Number one question that you have to ask, is this a whole food supplement? So meaning, is this supplement an extract or not? Okay? Because sometimes when we isolate a substance, okay, from the whole food, it becomes harmful.
Yes.
Okay? More often than not, but I'm not saying it happens to all cases. Okay? More often than not, it is so. So singular vitamin, minerals, or multivitamin supplements will not prevent recurrence.
So again, as Dr. Jansen said, when choosing supplements, the first rule of thumb is if you can, get a whole food supplement.
Yes.
What are some examples of whole
What
foods?
are some examples of whole food supplements? So these would be like your turmeric powder, garlic powder, or garlic capsules, turmeric capsules as well, your microalgae like Simply Nature PPARS. Okay, so that is also a whole food supplement. Your malunggay, your mangosteen. Okay, so those are whole food supplements. Okay, so but however, no.
Is there a
how
particular
they-
vitamin? Because if you're plant-based diet, there is one particular vitamin that's actually important.
Yes, it's vitamin B12.
Okay.
Now, vitamin B12, why is it so important? Now, vitamin B12 is only made by bacteria, so we cannot actually source this naturally from plants. And we only get vitamin B12 naturally through animal food products or animal protein. Okay, how is it so? It's because these animals, the cattle, the poultry, the fishes, the seafood, they graze. When they graze, when they eat the food around in their environment, they also eat the bacteria. So the bacteria that produces the vitamin B12, they also are able to eat. So the vitamin B12 made by the bacteria that they just ate, they store it in their body. And we humans eat the meat. Okay?
And we transfer the bacteria.
We transfer the vitamin B12 of the meat of the animals to our body. Okay? So what are the signs of recurrence that you should be mindful about? So number one would be the return of cancer symptoms that you had before. Okay, so for example, you had a lump on your breast and you had surgery. Now, that same lump would now recur on the surgical bed or where the surgeon just did the surgery or the incision. So a recurrence of a lump there would mean
it would mean that go call your uncle.
Okay? So that would be an example. Number two is a new or an unusual pain that's unrelated to an injury, or the pain doesn't go away. Now this is a sign of metastasis to the bone.
Oh,
Okay, so
that's dangerous.
Yes, that's dangerous. So that's one. Another one is old age.
Old age.
Okay, arthritis. Well, it happens to everyone.
I think that's a very important one. So if you have like aches and pains all over your body, that don't just ignore that. Like we mentioned at the beginning of the program, it's so convenient now. Do a simple teleconsult. You just need to book a time with a doctor like Dr. Jansen. 5 minutes, just get a peace of mind. Your doctor will probably ask you a few questions just to see if there's other signs and symptoms.
Yes,
and I think after 3 or 4 teleconsults, you'll probably be as good as your doctor as well, as knowing that, hey, just aches and pain is not enough. Do I have any other symptoms before you really need to schedule an appointment and go all the way down to the clinic to see your oncologist and perhaps get imaging done.
So next would be weight loss without trying. So this is unintentional.
Yeah, that's not a good
loss.
thing, okay?
Okay.
Everybody's always usually happy about weight loss.
Well, it would be good if you are already
Exercising.
overweight. If you're already overweight or obese on the get-go, right?
Alright.
That would be wonderful because you immediately reduce your risk of cancer. Now, if you are already someone on the normal BMI range and you're already someone underweight, then unintentional weight loss would be dangerous.
Yeah, especially if you're having weight loss and you're not doing anything except watching Netflix and eating junk food, and yet you're losing weight. Okay, it's not a miracle, okay? It means something is wrong.
Now, don't panic immediately, because there are also other diseases that has a similar effect. So, again, this just prompts you to go for a consult. Okay, this is important for you to know so that you just don't just put it on the side. Okay,
Be vigilant. I think that's the key
Yes,
concept.
correct.
Be vigilant.
Okay, so next one would be easy bleeding or unexplained bruising. So this one is more for patients who have undergone chemotherapy, because we all know chemotherapy side effects is it destroys the bone marrow and the platelets. Grows from the bone marrow. So if your bone marrow is quite destroyed already, then your platelet count can go down. Okay, and a low platelet count can result to easy bleeding or unexplained bruising.
So even though this may not mean that you have cancer, this is something important because you need to address a low platelet count.
Yes.
You need to address a low red blood cell, white blood cell count, because that's indicative of your immune system. And as Doc mentioned earlier in the program, you have circulating cancer cells. So you really need your immune system during this time. So if having bruising and bleeding doesn't mean you have cancer, but it means your anti-cancer systems are not working, and you should take immediate action.
So also for this same sign, for those of you who are leukemic or with leukemia, okay, the moment you see easy bleeding or easy bruisability, then that would be a sign that your leukemia has progressed or it has worsened. Okay, so this should prompt you to go back to your onco immediately.
All right.
Okay. Now, next would be a rash or allergic reaction such as swelling, severe itching, or wheezing. Okay. Cancer cells sometimes can secrete hormones that mimics this, so it can also be a sign. But of course, an allergic reaction or a rash can mean any other diseases as well. So again, please keep in mind that once you experience these signs, go for a consult, okay? Because this might be more, it's more benign than what you think, okay? Next would be chills and fevers. Now, if you experience chills or fevers, number one, it can mean an infection. More commonly, it can mean an infection. Number two, it can also mean that your cancer has come back. Why? Because cancers have a very high metabolic rate. So if your metabolism is elevated, then you will emit more heat. So that would manifest as a higher body temperature.
Oh, that's
Okay.
an interesting
So
thing to
that
learn.
would also be one of the signs. The next is frequent headaches. Frequent headaches can mean brain metastasis. Okay.
Okay, another
Another
worrisome
Yes,
thing.
another more worrisome thing. Also, frequent headaches can also mean lack of sleep.
Okay.
It can also mean a very benign thing. So again,
Don't scare yourself.
don't scare yourself. Go for a consult. Okay. Next one will be shortness of breath. This means that your cancer might have metastasized to the lungs, or it can be recurrence of lung cancer. Okay. Bloody stools, blood in your urine would mean colorectal or urinary bladder cancer, or it can also be cervical cancer. Okay.
And do remember, certain
recurrent-
cancers have high recurrence rates, so you
Yes.
should be aware of the average recurrence rate of your cancer. So that will help you adjust how vigilant or how sensitive you are
Yes,
when you see symptoms.
Okay, so next would be another telltale sign would be a cough that doesn't go away. So a cough that doesn't go away is also a sign that the cancer might have might have metastasized to the lungs, or it can, if you have lung cancer, it can be a recurrence as well.
Doc, you keep mentioning metastasized to the lung, to the bone. Is there a reason why you keep mentioning these two organs?
Yes. Because recurrent, when we talk about recurrence, okay, now keep in mind, if we say that you're on remission, there are already no signs of cancer left in your body. This
Yes.
means that you have undergone surgery as well.
Mm.
Okay, the doctor have already removed the solid tumor. Okay, now if the cancer will come back, a recurrence, usually it's on the surgical site.
Mm.
If it's not on the surgical site, then it's elsewhere.
It has already metastasized.
Yes. If it's elsewhere, that's already metastasis. And more often than not, it's in the brain, it's in the bones, it's in the lungs, or the liver.
Okay, so
those
these four
four.
organs, right? The brain, the bone, the lungs, and the
And the
liver.
liver. Usually, those are the four very common organs where cancer cells metastasize to. Also, the lymph nodes as well. Okay, but the lymph nodes is more of a regional spread.
Okay.
Okay, so
So now it makes sense why a lot of these symptoms, if it's related to the lung, is related to the lungs. All right.
right? So by learning all of these, now you will be more equipped to know when you go for a consult. Okay?
And I can see all the questions coming up. Probably more questions on the diet and what other supplementation. So I'm quite sure that some of the viewers will be asking Dr. Jansen, "Hey, I'm taking this supplement. Is this good? Is this effective?" So continue to stay online as people have asked their questions, and I'm sure some of the answers will be of interest to you. So without further ado, let's move on to our Ask Me Anything segment.
Right. Well, I am very, very sure that you have learned so much from that discussion led by our speakers. And we are now in the what we call AMA or Ask Me Anything portion. So let's not keep you waiting because I can see a lot of questions are coming in and are thrown to us before the webinar actually started. So to answer our questions in this modern world filled with noise of different health opinions, trust the ones from the experts. Let's call on once again Mr. Shyan Lim, our PPARS expert from Singapore, and of course our lifestyle medicine doctor, Dr. Jansen and Mr. Hello, good evening once again, Sir Shyan, and good evening, Dr. Jansen.
Good evening, Sheila. Good evening, Doc.
Hi, good evening to all of you. Please bear with my voice. It seems that I'm undergoing puberty again.
Sexy voice.
So, yeah, please bear with me, but I'll try to answer as much questions I can. Okay?
Thank goodness, Doc. Actually, I'm also just recovering because I got bitten by my dog and I had to do rabies shots. And my body always reacts to vaccines, Yeah. So, Sheila, let's just go and answer questions tonight.
Thank you, sir. Well, it just proves the dedication and the commitment of our health experts, of course, to provide knowledge to our viewers. Thank you, Sir Shyan. Thank you, Doc Jansen. To start off, the first question, very interesting, coming from Ms. Rose Campagnano. If the cancer returned, does it mean it's a new kind of cancer? It's not really a metastasis?
Doc Johnson, you want to? Why don't I take it first? Anything I miss, then Doc, you come in because
Okay.
just save Doc Johnson's voice. Okay. When a cancer recurs and your doctor tells you it's a recurring cancer, it's actually the same cancer. All right. However, the cancer is usually now metastasized to different parts of the body. So in general public, we generally have this misconception. If the cancer spreads to the bone, do I now have bone cancer? No, you don't have bone cancer. You have breast cancer cells that are now in the bone. All right, so that's very different from bone cancer. So when you have a recurrence, that is the old cancer coming back, usually in different places in the body. And the difficult thing about recurrence is this. This is the same cancer that your chemotherapy drugs and whatever therapy you used had successfully beaten, right? So it also means that this is the same cancer, the remaining cells that have adapted to the treatment that was successful the first round, which is why recurrence is always harder to treat because this is the survivor cancer cells. They were trained by your previous treatment. So the previous treatment is usually not going to be sufficient, especially if you were using oncological or drug protocols. Doc, anything to add to that? Yeah.
Yeah. With metastasis, the main definition for that is when the cancer has spread to distant parts of the body. So, for example, the cancer is breast cancer. So, if the cancer spread to the liver, the bones, lungs, brain, that's quite far from the breast. So that is metastasis. Recurrence is when you are already cured of cancer and then the cancer comes back, but it came back at the same site of the surgery. Okay. Also, recurrences can happen in distant parts of the body as well. No. So, for example, the patient already underwent surgery, breast surgery. Okay. Patient was declared in remission. And then 6 months later on PET-CT scan, surveillance monitoring, a brain tumor was found. Or let's just, not too morbid. For example, a lung tumor was found, okay? Lung tumor. And then upon biopsy, the lung tumor was actually a breast tissue, breast cancer. So in that sense, it is metastasis. It is also a recurrence. So don't be confused with the definition, no? Let's just make it simple. Recurrence is when the cancer comes back, okay? And it is a confirmed recurrence if it is proven by biopsy that it is the same cancer. It was the same cancer as the one that was previously diagnosed. That's recurrence. Metastasis is when the cancer has spread to distant parts of the body. That's metastasis. Okay? So you can actually have metastasis but no recurrence. Okay? Same thing with vice versa. You can have recurrence but not metastasis. Okay? Be careful with the definitions. All right?
Thank you, Doc Jansen. Thank you, Sir Shyan. Okay, very helpful answer for our question. Okay, another question thrown to us by Ms. Dolly Kalubad. Okay, is it okay to take anastrozole after 1 year of not taking it?
That's for Doc Jansen to answer.
If for some reason you stop taking anastrozole and it was prescribed to you initially by your onco, it is okay to restart, no? So you can take anastrozole again. However, of course, no, I would not just take it on my own since it's been a year. I would go back to my onco to ask advice if anastrozole would still be applicable. But technically speaking, yes. Okay, but in some cases, Anazole might not be applicable already depending on how your cancer evolved. If if you still have the cancer or if you are on remission. Yeah.
For this particular viewer, I'm sure there's a reason that prompted you to want to take the drug again. So you must have experienced some symptoms or something that makes you want to take up the drug again. So if that's the case, I really just suggest that you go for a consult, right? Obviously, something triggered you and made you worried and made you think about picking up a drug that you stopped for 1 year. So instead of guesswork, have a consult. And it's so easy to have a consult with Dr. Jansen because it's a teleconsult. You can just set the time. You don't have to travel very far. You don't have to brave the waiting lines and the queues. So yeah, don't live in doubt and don't self-medicate, especially when you're dealing with drugs. You can always make changes to lifestyle, and to a great degree, you can take supplements, especially those that you can find off the shelf in Healthy Options or GNC, which is now called LAC, I think. That can be done safely, but we never go back on drugs with the kind of same kind of I guess boldness or carelessness. So if you're going to go back on your drugs, I really suggest have a consult with Dr. Jansen so that you can peace of mind. Yeah.
I totally agree. For those of you who wish to have a consult with Dr. Jansen, the link for you to schedule a consult is in the description box, or just simply type in how to consult. Miss Beth and Miss Irish of Simply Health Medical Group will definitely get in touch with you. All right. Now, next question coming from Miss Nar Colin. After chemotherapy, what are the tests that should be done to assess the effectiveness of the treatment?
Oh, that's interesting.
It is. It is.
Yeah. It would be your tumor markers and your imaging studies. Okay. Me personally, I rely more on imaging studies rather than tumor markers because tumor markers are non-specific. The only time that I will use tumor markers is when you already had the baseline. But if you don't, it's gonna be useless to rely on tumor markers. Okay? Because tumor markers is used to gauge treatment response, and we try to see the change in the tumor marker, not really the absolute number per se, meaning not really the numbers per se. Okay? So a person, for example, no, a person who has a tumor marker of 100 might be in a better situation rather than a patient who has a tumor marker at 50, depending on the status of the tumor. Okay? So I'm not totally reliant on tumor markers. So I rely more on the imaging study. I want the tumor to shrink or disappear or become a scar. That's what I look for. Okay.
Now that makes absolute sense because when we do biochemistry tests, which is your markers in your body, other comorbidities that can give that can make the results skewed. Like for example, PSA levels have always been used to gauge, for example, prostate cancer, but there are many reasons why your PSA levels can be elevated, right? So again, if your cancer is at the stage where you're monitoring a tumor that is already identified, then as Dr. Jansen says, nothing is more convincing or sure than on the imaging, you see the actual tumor shrinking. So I definitely at the tumor stage, where your tumor is still visible, imaging is the best choice. Yeah.
I agree. Yes, this is also something that I've learned from Dr. Jansen. Whatever it is, whatever modality that was used to detect your cancer is also kind of the same thing that's used to assess if your treatment is effective. Okay, thank you. All right, another question coming from Miss Christine Banold. What are the symptoms of brain metastasis?
Okay,
Doc, you
for
mentioned,
brain
right?
metastasis,
Yeah.
brain metastasis, so there is something inside your brain. Okay, so it can present as a stroke-like symptoms. It can present as headaches. Okay, but more commonly as a stroke-like symptoms.
Okay.
Sheila, you're muted.
Sorry. Well, just before we go to the next question, I just want to greet, of course, our viewers for tonight. Starting off, of course, with Miss Dolly Kadubad, Flordelina Tuporan, Mante family, Lingeswaran, Kean De Castro. I can see a lot of new names. Thank you for watching us. Marivic De Gala, Edna Aveo, Rose Campagnano, Louis Tuason, Mavs Avot, thank you. Near Colin, Christine Banog, Maricel Plaza, and of course, G. Marie Apple. Thank you so much for watching us. I just want you to know we are nearing, well, not 200, but around 170th episode now. And it's
Wow.
a great appreciation and gratitude to all of you for always watching our Simply Nature webinar. Thank you so much. All right, another question coming from Ms. Maricel Plaza. Question is intermittent fasting good for cancer patients because you are starving the cancer cells? Is this okay? Good question.
Yes, yes, yes. Actually, there are a lot of studies on intermittent fasting and cancer patients, no? Actually, there are some who even extended the fasting period up to 72 to 96 hours. And there is one case study where a lymphoma, stage 3 lymphoma patient went into remission just after 96 hours of fasting. So definitely there is some value there. However, fasting you should be monitored closely, by a trained healthcare professional, a trained doctor. And of course, you have to be in a facility as well. Healthcare facility. It can be a hospital or it can be in a wellness center, no? And you have to stay there to be monitored. For intermittent fasting though and cancer patients, since one of the concerns of cancer patients is they lose weight. So intermittent fasting cannot be applied to all cancer patients because if you are very thin already, you'll suffer more if you undergo intermittent fasting. It will do more harm than good. If you're someone who's obese or overweight, then by all means you have to undergo intermittent fasting because if you are obese or overweight, your overall survival shortens. It means you have a shorter lifespan. Also, the recurrence rate is very high. Okay? So that is for obese or overweight individuals who got diagnosed with cancer. This is also true even when you are already in remission. Okay? Because recurrence rates are very high if you're overweight or obese.
Doc, for intermittent fasting, why it's good for cancer patients? Because am I correct that when the body actually goes into fasting, its immune system is actually stimulated, provided everything is healthy. All right. So obviously, if you are already malnourished, very weakened by chemotherapy or surgery, then then you have to be careful. But actually, if you are still of good weight, eating well, generally strong, when you actually fast, your body goes into a defensive mode, and your immune system is actually being stimulated. Is that the one of the benefits of intermittent fasting, Dr. Jansen?
Yeah, when you undergo fasting, your body actually stimulates the repair mechanisms, every repair mechanisms. So the old cells, the defective cells are being replaced by new ones that are working well. Okay, so it's like the young ones replaces the old ones. Okay, so that's the benefit of fasting, and it also stimulates the longevity genes, the genes that promotes lifespan. That promotes life expectancy. That extends life expectancy. Yeah, so that is the benefit of intermittent fasting.
So to everyone out there, this is why it's so important that you not just beat cancer, but you get healthy. When you get healthy, then you're able to do powerful things like intermittent fasting. So if you generally don't take care of your health, if you have metabolic syndromes and you have this and that, then it's so difficult, right, to use all these many powerful options in your life. So even to all our viewers watching us tonight, this is a cry or this is a discarte or important strategic move. keep yourself healthy because we never know when we fall ill. We never know whether, Dr. Jansen always talks about this before. Sometimes you can do everything right. You don't smoke, you don't drink, you exercise regularly, you eat a moderate lifestyle. That means not a super unhealthy one, but one that is generally healthy. And yet you are struck by cancer, right? So sometimes you may feel, oh my goodness, then what's the point of living such a clean life if cancer's still gonna get me? Although cancer can happen for many, many reasons, right? All these things like smoking and drinking, they add to your chance of developing cancer. But if the reason for you to develop cancer was there, and if it comes, then being healthy, eating right, not being a drinker, all that is just going to increase the things that you can do to successfully fight off cancer. So again, if you are healthy, you're of good weight, then you can use intermittent fasting, which is so powerful that Dr. Jansen just shared. There was even a case just by intermittent fasting, the person was able to reverse the cancer, successfully fight off their cancer. Right? Yeah. But again, if you're weak, please don't do fasting if you are already skin and bones, right? Okay.
Thank you, Sir Shyan. I just want to make a follow-up question because another very common question that we get is how about keto diet? Is it okay for cancer patients?
What a good question, Doc.
Okay, we have a dirty keto and we have a healthy keto diet. Okay, if you go on the dirty keto diet, that you can get diabetes, you can get heart disease, all other diseases. Okay, it can also shorten your life expectancy. It would be better if you go on a healthy keto diet. Okay, so if you're on a healthy keto diet, that means you eliminate all the processed carbohydrate. So that would be your pasta, your bread, okay, all of those foods related to those food items. Okay. Also, you'll be basically consuming plenty of good fats. So good fats coming from seeds. Microalgae is one. You have your beans as well, avocado. That's what you want. Okay, the good fat. Also, when it comes to protein, for cancer patients, it's very important to increase your protein intake. Okay, because if you increase your protein intake, immune system will work well. Okay, so basically that's how you should be doing it. Okay, avoid dirty keto. That means avoid animal protein, avoid animal fats. Okay, consume plenty of plant foods. Okay, for cancer patients, the default diet is a plant-based diet. Okay, there's no question about it. Even the oncologic societies abroad are recommending uh, that same diet. Also, in the integrative medicine world, okay, that means the alternative medicine world, okay, they're also basically speaking the same or putting out the same message. So at this point, it should not be a dispute anymore.
Yeah.
No more stubborn. Okay.
So the challenge is most of the time when people talk about keto diets, they are talking about dirty keto diet because it's about eating a lot of meat and some vegetables and zero carbs, which is of course very easy to do in our modern day diet world, right? You just go to a fast food restaurant, eat your burger without the bread, and then you will be fulfilling the dirty keto diet, but that's not actually healthy. Dr. Jansen, I've actually spoken to doctors who use keto diets. For example, doctors who use keto diets for the treatment of epilepsy, especially in children, autism as well. But they actually tell me they never go more than 6 months. 6 months is like the longest that they will do, and usually just 3 months. So again, this is very different from the general in the media where you hear people, I've been on keto for a year, 2 years, 3 years. Yeah. So and then so that's actually the truth, and it's very skewed. All right. So If you want to know more, then ask questions about keto again, because we can go into things like metabolic syndromes and why keto diet seems to work for diabetes, but actually it's just an illusion. But if not, I think I'll just end my comment over here.
Thank you, Sir Chan. This means that this is also a shout out not only to our cancer patients, but of course those who are on preventive as well. Okay, all right, thank you. Another question coming from Mr. Joe Lim. Okay, can we take PPARS even though we don't have cancer?
Definitely. I'm taking PPARS. I've been taking PPARS since I was 27 years old. I am 50 years old this year. So I just came back from Mindanao and I was speaking to an entire group of surgical oncologists, and they were asking me so many technical questions, Doctor. So I just want to share with you. Yes, it's one of the best basic supplements. You don't have to go for the soft gel or the powder. Just go for the tablets. Honestly, I believe our tablets is one of the best products out there in the market for any health supplement, right? It covers all the vitamins, all the minerals in general. But then what is really important, it contains PPAR agonists. It's high in chlorophyll, so you don't need to eat like your wheatgrass. And I can't stress this enough. When you simplify your supplementation, it's easier to stick to it. You know, if you have to take 6 different types of supplements, it becomes a chore. So for me, compliance is easy. I get all the effects. Now, if I suddenly need anything specific, for example, if I went for a blood test and my vitamin D levels are low, and then I might want to take, if I'm vegetarian, I want more B6 in my diet. B3 or B6, sorry, B6, yeah, right? Then I'll take the additional supplements. But if not, the tablets. And the tablets will help you manage inflammation. Very important for health today. Even mental health, everyone, right? Because neuroinflammation is one of the core foundations that leads to brain disorders. Okay, so inflammation, very important. Next is it manages your metabolic syndromes. So your blood sugar, blood cholesterol. Okay, so yeah, yes, you can, and take a lot of it.
There you go. Excellent. Thank you, Sir Sean. I couldn't agree more. I think a lot of them are asking, why is that so? It's just the term antioxidants. PPARS has a lot of it. That's why. All right. Another question coming from Ms. Flor Delina Duropan. Okay, another PPARS question. Is it okay to take PPARS, just the PPARS tablet while I'm on my chemotherapy journey?
Okay, I think I'll let Dr. Jansen answer, but I'll say PPAR tablets is a must to take because it helps you very foundationally, right? It helps you manage all your comorbidities and so on and so forth, right? Just like why even a healthy person would take it. However, if you're going for chemotherapy, I would definitely suggest something stronger, especially during the week or the days before and after your chemotherapy. So the lowest level that I'll recommend is actually the soft gel capsules. Okay, so if you're on the soft gel capsules and you go for your chemotherapy and you feel fine, then you're good. Now, if you go on chemotherapy and the soft gel capsules, you still feel very fatigued and all the other side effects start coming, then you will need to go on the powder or the liquid extracts. Powder first if you are financially challenged, but if you are in a very serious case, for example, you are late stage cancer, your body's already very weak and you're going for chemotherapy, then I would straight away say start with the liquid. Get yourself strong first, you know, make sure that the first few sessions of chemotherapy go well for you. All right, you don't want to be weakened right from the beginning. Then after that, we can adjust your dosage to powder or maybe even soft gel if the chemotherapy is going well with you. Doc, what about you for your patients?
Okay, here's how I do it. So I first need to know what kind of chemotherapeutic drug that's being prescribed to you. There are chemotherapeutic drugs wherein I advise patients to take it together with their PPARs, no? There are also other chemotherapeutic drugs wherein I advise patients to don't take PPARs together with it. Okay, so it really depends on what kind of chemotherapy you take. Okay,
Doc,
that's
just
me.
Sorry, Doc, just to clarify, when you say don't take together, you don't mean don't take, right? You mean just don't take on the same day, right?
Yes, yes. Don't take on the same day. So it's on a separate day. Okay? But there's a timing in that depending on what kind of chemotherapy you're taking. Okay? So if you really want to know which PPAR protocol would apply to you and what kind, no, you have to go for a consult because I have to know the drug, the chemotherapy drug, and the stage of cancer that you have. So from those two information, I can more or less recommend something for you.
As a follow-up answer, because I noticed Miss Connie's question. She said she was having chemo last May 2023 until October 2023. She has bone metastasis and having treatment zolondronic and fulvestrant. Is it okay to take herbal tablets and herbal drinks? Okay, my comment now. I don't know what you mean by herbal, because herbal does include traditional Chinese medicine. All right. So that one, I would say you have to tell your Chinese physician the drugs that you have been taking. And I won't make any other call apart from that. Okay, but if you're talking about PPAR tablets and PPAR supplements, yeah, it's absolutely fine. Okay, but again, when you take herbal remedies, do remember herbal remedies are not simply supplements. They are herbal. Okay, they are not food supplements, right? I hope everybody, all the viewers out there, can differentiate, or you should differentiate the difference between a herbal remedy and a supplement. A herbal remedy is natural drugs in the sense that herbal remedies also have side effects, which is why they're called herbal, which is why a traditional Chinese medicine doctor has to go for years of training. All right. And my friend's uncle is a famous TCM. So when my friend told his uncle he's studying TCM, his uncle said, okay, that's great. Be prepared to keep on studying until you're 70. 70. So what he meant is medicine is really a lifelong journey. You keep learning new things. So it just goes to show that herbal remedy has its dangers. That's why you need information. You need to be properly trained. Okay. So to your question, PPAR protocols, no problem. Food supplements, most likely no problem also. But herbal remedies, make sure your TCM is made aware about your condition. Right? And if you tell the TCM your condition and you find that his answers are very general and you're not confident, then I would say look for other supplements or wait a year or two more when Dr. Jansen finishes TCM, he can advise you, right? But yes, be careful, everyone, because herbal remedies are no joke as well. Okay, they require expertise. In Singapore, TCMs are all licensed. So the herbal remedy, you need a prescription to give it. Okay, thank you.
Thank you, Sir Sean. I just want to make everybody understand, no, what you're getting here from Simply Nature webinar is a perspective of different fields like medical by Dr. Jansen, integrative, no chemo, just radiotherapy. During the operation, one time only, I am taking tamoxifen. How often should I go to my surgeon for checkup?
Okay, you're already on remission. Okay. For your case, during your first year, should go see your surgeon once every 6 months, at least once every 6 months. Okay. When you go back to him, there should be a scan. Okay, there should be a PET CT scan or a CT scan of your chest. Okay, that is to monitor any recurrences. Another scan that I would recommend is a bone scan, bone scintigraphy scan. Okay, that is to monitor any bone metastasis. Right? You should go see your surgeon once every 6 months for the first 2 years. That's me. Okay. After the first 2 years of being cancer free, once a year would be enough. Then after you finish 5 years, then yeah, you graduated already.
Thank you, Doc. Doc Jansen, does it also apply to the surveillance monitoring, CT scans, and laboratories? Is it also like every 6 months, every year?
Yes, that's what we are trying to do, no, during these follow-ups. So you don't just go back to your surgeon and say hello and say hi, you know. You have to do these scans, you have to do these tests. If your doctor did not tell you to undergo these tests, please ask them if you have to undergo these tests, okay? Because sometimes, you know, doctors us are human as well. So sometimes we do forget, sometimes we do miss out on these things because of a lot of information, because of the sheer number of patients that we are seeing, okay? So if and when your doctor, it seems that your doctor did not mention anything about these, please ask them, okay? It might just be something that your doctor might have, you know,
Slip his
forgot
mind.
or
Yeah.
missed to mention.
Yeah. Yeah. I just want to appreciate Doc Johnson. I can see, Doc Johnson, you are really straining your voice. Thank you so much. And to all our viewers, you know, I think I encourage everybody to type an encouragement to Doc Johnson now in the chat. Okay, I just want to answer Miss Nelia Mojica.
Yeah, the
All
ear.
right. Please message us the name of your oncologist. We would love to go to Makati Med. The last time I was in Makati Med to talk to doctors there, they were very receptive, you know, they were very receptive. However, there are some restrictions or protocols that you have to go for Makati Med. So you have to go through like medical director and everything. It's a process because hospitals do have their own rules and regulations for each hospital. So that process is just a long process. But yeah, maybe it's time for us to revisit again. So Miss Nelia, kindly give us the name of your onco. Or if you do know many oncologists there, refer us someone so that we can arrange for a talk with them. If not, I think within the next year or so, by end of 2024, we probably will make our rounds to Makati Med again. Yeah, but right now we're gonna join the Philippine Oncological PSO, Society of Oncologists. We are going to be part of the event at the end of the year. So I think from that point on, many more oncologists will be familiar with us.
Thank you, Sir Shyan. Thank you, Doc Jansen. Okay, another interesting question. Can I take PPARS while I am already doing immunotherapy?
Oh, wonderful. Yes, you can. Dr. Jansen will mention the specific the identification of the cancer cells. That means it helps your body to identify the cancer cells. However, you still need the different components of the immune system. When we talk about the immune system, to give a complete or more comprehensive answer to that, it is multiple parts. So it's the detection. The ability to detect the cancer cell is part of the immune system. Now, Doc, maybe you can comment on drugs, immunotherapy drugs that actually you've described patients to use PPARS with. Yeah.
I did the whole video on that. I think it was
I think we just did that, right? The 2 weeks ago.
yeah, I think it was a two-part video, no? Go and watch that. You'll learn a lot.
You'll learn a lot. You'll learn how immunotherapy actually works.
Actually, I just want to invite, as early as now, I'll be inviting everyone because that is going to be next week. Our topic about immune details I will be giving after the AMA portion. Okay, so please stay tuned up until the end of the program. Now, at this point, this is another interesting question coming from Riaza Tristet. Sorry. Good evening. I'm cancer survivor. I just want to know if my kids can take the PPARS tablet as preventive purposes to avoid cancer.
Oh, let me answer this. Absolutely, absolutely, absolutely. It's the best supplement you can give for your kids. I'll give you a very good how shall we say testimony from my own family. My niece had a cyst that was growing on her lips. It was very big. It was the size of a fingernail. At that time, she was about
I can't remember specifically, between the ages of 4 to 6. So she was, I think, 4 to 6 before she go to grade 1. She was not in grade 1 yet, so she was in kindergarten, right? So she went to the pediatrics. They wanted to cut out the cyst on the lips. It's benign, but the pediatrician said, let's just cut it out. And the thing is that because it was on the lips, my niece had to be put on general anesthesia. So my mom, like all mothers, even without researching, she just assumed that general anesthesia is unnecessary risk for her precious daughter. So what happened at that point is then my mother said to my sister, hey, your kuya, your brother's product deals in all these things. Maybe you should finally try your brother's products, right? Strengthened and supported. It can probably rectify a lot of things, right? So now, because of that move, my niece, my nephew, my sister, my brother-in-law all eat the product and they don't pay me. They just get from me for free. All right. But I always stay at their house when I go to Singapore. Okay. And my nephew takes it religiously, right? And it's been so good for him. He does very well in school. I'm not saying that PPARS makes your kids smart, but those commercials that says that all those infant formulas with DHA and CGF to help your child develop their brain. Well, Simply Nature PPAR tablets contains lots of DHA and CGF. All right, we have higher CGF content than even a normal microalgae. So there you go. All right, but I think why my nephew did well is simply because when you're more healthy, you're alert in school. When you're alert in school, you absorb what you're being taught, and you enjoy school all the more, right? Because you're not sleepy and you can participate. So that is all snowballs, and he ends up doing well. And I believe Dominic is doing well in school, and Dominic definitely takes lots of PPARS from liquid to tablet, right? So is Dominic doing well in school, Sheila? You keep mentioning.
For 4 straight years, he has honors. And
oh, wow.
Always called stage. Thank you, Lord.
Yeah, and
Yes.
I want everybody to know this. Dominic is a recovering cancer patient. He's now in remission in his 5th year. And for the past 4 years, he's an honors student. So that's just good news to all cancer patients, right? Can have a full life and do very well in life. Yeah.
Actually, sir, I just want to mention this, because we have a lot of old patients who were using like the liquid extract, the PPARS powder extract, because they were on help with prevention with cancer.
Yeah.
Okay.
Yeah.
All right. Okay. Another question, very specific, coming from Ms. Minda Banela. Doc, Doc, is it okay to take PPARS alongside the synthetic medicine like Daflon 1000?
Yes, it's okay.
It's okay. All right. Coming for another question, Christine Banaug. Can a PET CT scan determine if 0.02 cm lung nodule is cancerous?
Yes, it can. It can.
Okay. All right. Thank you, Doc. And then another question. I have stage 1 breast cancer. What PPARS or what PPAR form should I take?
Oh, wow, Doc.
Depends. Depends if you have had surgery already, other treatments for cancer. But if you are only going to take PPARS and you have stage 1 breast cancer, I will go for liquid.
Same suggestion. Yeah.
Okay. Thank you.
Okay. Again, I think cancer treatment, one of the how shall we say, one of the important factors to take note of is financial strength. All right. So when you speak to Dr. Jansen or any of our when you ask questions in the chat group, right? Do let the person know your financial strength. All right. So the liquid is on the financially is a little bit more it's more expensive than the other protocols. But good news is your stage 1 breast cancer. It is our policy on our program to tell you the best. All right, because we don't want to make any prejudgment. Many of our patients that go liquid all the way actually come from middle income and low income groups. yet their children, usually is their children, made it, said yes, they wanted parents to get the best. And praise God that for many of them, it's been worth the journey, right? However, if you do have any financial concerns, do let our customer service and our medical healthcare specialists know, all right, so that they can adjust a protocol. So don't worry about that. Okay, don't worry about that.
That's true. That's actually true. And this is also the same reason why we ask a lot of questions. Even Doc Jansen is also asking a lot of questions. It's not only that we are considering the health concern, but also the budget. And we understand that it's really a big chunk of the cancer journey.
So to all the viewers, don't be shy when it comes to financial concerns. This treatment itself, right? I mean, when you have to go through surgery and when you're experiencing chemotherapy, it can be very draining. However, the other most important concern is finances. All right, finances. So this is something that we are very happy to participate with you to give you the best option. So don't be shy. Don't be shy. We will be able to tailor a program that fits your budget, and it will still be effective. So we'll get you the most effective protocol that you are able to sustain over time, because sustaining it over time is very important.
That's true. Thank you, Sir Shyan. Thank you, Dr. Jansen. Okay, another question coming from Ms. Winnie Coleman. I am negative HRER2, stage 1A, now from DCIS grade 3. How many cycles of chemo should be? And I have been taking PPARS powder.
I think this is a question for Dr. Jamie. Yeah, I think it would be better if we can ask him. But for stage 1, again, depends. So if you have if it's stage 1, usually we don't recommend chemo, even if it's stage 1. Yeah. But if ever some onco will recommend chemo, I think it would just be 3 cycles or 4. Probably definitely not 6. I think, yeah, probably 3 or 4 cycles only. But definitely you have to ask Dr. Jamie. It would be nice if we can have Dr. Jamie answer questions as well.
Yeah, actually, guys, good news, just in case you don't know, Dr. Jansen is part of Simply Heal Medical Group, a consultant over there. So is Dr. Jimmy. So if you want to make a teleconsult with Dr. Jimmy, please just drop a note on the chat box, and Beth and Irish can help you as well. Right? Yeah, and come for our SMX live. You can ask Doc Jimmy and Doc Jansen there.
By the way, probably Miss Winnie is wondering who's Doc Jimmy. What is he? Dr. Jimmy is a surgical onco. By the way, I'm sorry I did not mention. He is a surgical onco, so he would be the best person to tell you, really.
Yes, in fact, not only that, just like Dr. Jansen, Dr. Jimmy is also on top of his field. So he's a very popular surgical onco at what's that called? Manila Med. In fact, he's the face of, I think he's also head of their cancer center. He's head of their cancer center as well.
Yes, he is also a training officer. He trains young doctors as well. So yeah.
So he's really an authority. And the best thing about Dr. Jimmy is Dr. Jimmy is actually very how shall we say, well-rounded, right? He actually was looking for ways and supplements to support his patients, which is how we first hooked up with him, and now it's become many years of friendship. In fact, another top doctor from PGH, like Dr. Ignacio, is another wonderful doctor, very open to many options, not just oncological protocols. In fact, Ciela works with him for one of the advocacies, which I won't mention here on our program. Yeah, but yes, so if you want to know more, you can private message Ciela.
Definitely.
But it's so good. I know many of our viewers out there, when you talk about supplements to your onco, many of them just say, no, don't take any supplements while you're undergoing protocol. But actually, there are many top doctors and good doctors who don't say that. who actually will recommend some adjunct support like PPAR protocols, right? So, and these are like head of cancer centers. So, and Dr. Jimmy is just one of them. Yeah.
Thank you, Sir Shyan. I'm very sure, while we are talking about doctors, I can sense that a lot of our viewers tonight are thinking about who are the doctors who have very compassionate throughout their journeys. Because we are talking about remission tonight, and all of those parts of journeys are really, of course, involving a lot of people, most especially doctors. And I'm sure you're thinking a lot of those people right now. Okay. All right. Now, one serious question coming from Ms. Rose Campagnano. I have heard people dying from cancer recurrence after just a short while from its onset. Why is this?
Okay. Doc.
To be honest, I don't really know.
Uh,
Why is it so? I also wondering myself, no?
Doc, let me
Yeah.
let me put in my views, all right? Okay, so this is my views, not Dr. Anson's views. Well, if he agrees, he'll chime in. My view is this, right? Many people who went through oncological protocols, like especially like chemotherapy and radiation therapy, they didn't do much to protect and nourish themselves during these protocols. All right. So, for example, you were successful with chemotherapy, radiation therapy, but during that time, you took no other steps to protect yourself. So, what happens is that your body, the protocol successfully remove cancer cells from your body. So, based on your diagnostics from your imaging and your blood works, right, you are cancer free. Take care of them, and they are too small to be detected by either blood works or imaging. All right, which is why many cancers aren't detected until they are in their late stages. Okay, so what it means is that for sure you do have cancer cells that was malignant, that was active in your body. Now your protocols like your chemotherapy and your radiation therapy left you weak, right? You're tired, your body went through so much stress from the recovery. So if the cancer comes back during the recurrence, during this period, it's hitting you when you are really, really weak. And it's an experienced cancer. It's the same cancer that has probably adjusted. It's even tougher. Plus, the fact that your body is weak at this point, haven't fully recovered. It's just like, a lady that is pregnant, right? After you give birth, you are very susceptible to, that's why in the Chinese, for 1 month, they cannot bathe. I know Filipinos don't have that practice, but the Chinese, you can't bathe for 1 month because they don't want the why recurrence is so brutal when it does happen, okay? For most cases. Doesn't have to be very complicated. Just this understanding is probably enough, which is why we cannot stress your body and help you recover, because your fight against cancer does not end with the first round, right? You've got to come out, you can handle it, right? So it's so important to do something when you're going through your treatments. So with that, I think I that's the final thought I would like live or to arrange for a consult with Dr. Jansen and just have him look at your records, right? Look at how many chemotherapy sessions you went through. Did you go to what other surgery? Are there other comorbidities in your health? Are there other areas of your health that you need to take care of so that the recurrence won't come? All right, so you can do something. That's my last word as well, Sheila.
Is it? Because we still have one
Oh,
last question.
last
Yeah.
question.
Okay. One last question, very quickly, coming from our YouTube. Due de la Cruz, is it misdiagnosis if the cancer stage prior to surgery was stage 1B1, but after the surgery, it went down to stage 1A1, as shown in the histopath? Is it a misdiagnosis?
No. It's not a misdiagnosis. Well, it's good news, no? That from stage
Yeah.
1B, you went down to stage 1A. Now, before the surgery, we can only guess. We can only, no, not guess, no? We can only deduce or give an estimate what is the current stage of a cancer is. The stage that will determine your true staging would, of course, be after the surgery. Okay? Once proper imaging studies have been done as well, that is when proper staging can be done. So it is not a misdiagnosis. Okay? It is still stage 1. It's just the letters that was changed. Okay? And from B to A or A to B, there's not really that much difference. The treatment approach between stage 1A and stage 1B is not that different as well. Okay? So don't be too academic on it. Okay? Um, take peace or take solace in the fact that from stage 1B, it went down to stage 1A. Okay? So, that
in remission and about to finish his remission this year. What I've been learning out of danger. This is something that I really learned here in Simply Nature, to always be vigilant, even though you are already cancer. Talk to patients, share your stories with your fellow patients in the hospital. It can help them and it can also help you. And because I've been hearing some people after they got remission, they're going. Like I said, stay in the loop, keep yourself healthy, stay vigilant, and listen to Simply Nature webinar. Because all the things that I've been learning here is something that I try my best to apply to my kid. And I thank God for all the learnings and the knowledge that I've been getting from Sir Shyan and of course Dr. Jansen, and along with our other doctors from my kids' hospitals. Thank you so much. So now I'll be asking for a very quick parting words. Maybe first from Dr. Jansen, and you may want to add Sir Shyan if ever.
thank you for bearing with me tonight. It's really been a struggle for me to speak, no? And thank God we're done. But next week, I'm not gonna be in because I'll be flying to Palawan. Okay, so I'll be seeing you guys after 2 weeks. Okay, to answer more questions. Okay, it's always fun to answer all these questions. No, we've been doing this for 3 years already. I think it's more, even more. Yeah, and the questions do not repeat. There's always something new.
There's always
That's why it's
something
so fun to
very
do.
new. Yeah.
Yeah, that's why it's really fun to do this. So, I just want to thank all of you, no, for patronizing our this program. Without you guys, we won't exist. And of course, with you as well, those who are asking questions, it's not just you yourselves that are being helped or that is being helped. Other patients are also being helped. Those with the same questions as well. So keep asking those questions. All right. So thank you, everyone. Good.
And
Sir Shyan?
for me is I want to thank Dr. Jansen today. You can see how much effort Dr. Jansen put in. He's like pushing through. And to be honest, this is something that we do as like an advocacy. So there are times on Thursday night at 7:15 when I log on, I'm like, I'm so tired after a whole day. This is not even my job. Right? We are not, Dr. Jansen and I are not TikTok stars. We are not social media influencers. This is something that, you don't see us. We don't have TikTok or anything else, right? But this is something that we just do as an advocacy, and I guess as a contribution back to the very industry that we serve in. But every time when the Q&A starts, we get energized and we get focused because we know we are meeting your needs, that we're talking to cancer patients, that you're asking questions that are important to you and your loved ones. And we have to take that as seriously as we can. So thank you again for your trust. Thank you for being with us for all these years. And please recommend next week's program to your friends and family so that we can get encouraged also with more questions, and wishing everybody a great week ahead. Yeah.
Thank you, Sir Shyan. Thank you, Dr. Jansen. See you next week. Okay. Thank you. All right. So At this point, of course, I'd like to invite everybody for the upcoming next webinar. This coming June 6th, that's another Thursday at 7:30. Our webinar is entitled Immunotherapy Awareness Month webinar, actually. So this cover how immunotherapy helps manage cancer. So that, once again, that is next Thursday. Do invite and share the event to your fellow patients in your hospitals and, of course, fellow loved ones as well. Okay. Also, please don't miss out on our biggest mega sale of the year with the discount on all your favorite PPAR form and basic PPAR forms, I must say. Okay. So this is a perfect opportunity to try PPARs. This is happening on our 6/6 Wow Sulit Tipid sale. So we will be having, of course, our last live. Watch out for that. It's happening at June 6th, 4 p.m. Okay, there you go. All right, another one. Of course, I'd like to call on once again all the cancer patients, survivors, and advocates. Let us all come together to explore the latest advancement in cancer treatment and engage with multidisciplinary experts dedicated to enhancing your well-being. This is happening this July 27. That's a Saturday at SMX SM Aura at 8 a.m. So our panel of experts is composed of PPARS expert, lifestyle medicine doctor, integrative doctor, and surgical oncologist. Take advantage of the face-to-face AMA portion where you can ask our doctors live during the event. So please watch out for our announcements, and you can actually get your tickets as early as now through our website, and please message us on how you can also get the tickets easily. Okay. All right. Now, once again, I just want to say your victories over cancer and metabolic illnesses and other illnesses is what actually keeps us going here in Simply Nature. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing.
Now you know, cancer eats what? Cholesterol, right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening, right?
Especially if we are talking about solid tumors. The number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, plus very honest sila sa mga questions, sa mga pagsagot sa mga questions. Basta, nasasayahan ako. Ganun.
We're always with you from start to healing.